problem with women's health is multifactorial and steeped in lots of issues. First, you have to find a doctor that knows about hormones, menopause, and most doctors aren't trained, and you're going to assume your OBGYN knows about it, but they're usually just good at surgeries and catching babies. So this is where I recommend going to the North American Menopause Society and finding someone who is trained, so a NAMS practitioner. Now, this could also be a PA or a nurse practitioner because a lot of MDs aren't trained. And at this point, we are just hoping to find someone to hear you, because diagnosing you with perimenopause and menopause through blood work, it's not going to happen. They have to listen to your symptoms. That's what the menopause practitioners that are trained will tell you. The blood work's not going to really matter. They're going to have to listen to you. Now, of course, they rule out other things like thyroid dysfunction and anything else, because that's what healthcare practitioners do. They rule things in and out. But you and I both know that the amount of time you get to spend with a doctor is anywhere from 7 to 15 minutes at best. And in that time, you are listing off your symptoms. They're checking you for red flags. They have to type a note. They're probably going to write you a prescription. They will look at your blood work, but they only have so much time to work with you. And this is where there's a problem. With women's health in general, it is a team approach. I am a physical therapist. I specialize in women's health, and I have realized that I am super quirky, and there aren't a lot of people like me, but there should be more people, because here's why. I'm Wendy. I'm a physical therapist. I am trained in women's health, manual therapy, orthopedics. I used to teach at the University of Dayton. I do research. I read. I write. I am obsessed with all things women's health because there is a massive gap in our system. Women need to know the science of wellness and healthy habits and lifestyle changes. I am on here talking about hormones because there comes a point when only lifestyle habits and modifications can get you so far. And when I watch people suffer, then I'm like, listen, you need to go to the doctor. You need to talk to them about hormones. But on the flip side of that coin, we really do need to teach people healthy habits, lifestyle modifications. Like fiber becomes so important because as your hormones change, your gut microbiome changes. Once you hit 40, you're losing 1% of muscle mass each year and bone density, and you do need somebody like a physical therapist that specializes in women's health to help you figure out where your deficits are, where your hips are, where your shoulder range of motion is, where you are. So not everybody has access to a physical therapist that knows these things. Sometimes it's a personal trainer that is really good at taking care of women. But women need coaching and they need help because we have lost the art of wellness. We don't have a society where wellness is part of our everyday life. Now, funny enough, when I was in PT school doing a clinical, I lived in a blue zone. I lived in Loma Linda and practiced at Loma Linda University. And I learned a lot living with the Seventh-day Adventists because that's really what makes the blue zone. They truly have a eat, breathe, sleep, health lifestyle, and they truly rest on their Sabbath. But overall in the US, we don't have healthy lifestyles. But as we age with women, we have to become a bit more conscious of our choices. So we have to rest more because we are losing estrogen, and estrogen helps us broker cortisol. So we have to learn how to cope with our stress. Estrogen is cardioprotective. It protects our heart. So we have to really be wise about protecting our heart. So walking, strengthening our heart because it's a muscle. Estrogen is also neuroprotective. It protects our brain. So we need to sleep so our brain can heal. And we need to do things that stimulate our brain, but not overstimulate us. Estrogen helps us broker inflammation, so we need to learn how to control our inflammation. Now, this is something that you could probably do. So when I talk to my patients about a healthy lifestyle, I'm asking them, are they eating oily fish 2 to 3 times a week? If they are not, they need to be taking an omega-3. The standard American diet is high in omega-6s, so taking a fish oil is something that is very helpful. I'm also a big believer in women getting their vitamin D levels checked every 6 months because vitamin D is not a vitamin. It is a hormone that is very important for breast and pelvic health, believe it or not. So there are things like checking your D, omega-3s, and if you have lots of inflammation, turmeric is exceptionally helpful. Now, I am not a dietitian and nor am I an MD that prescribes things, but I can tell you common things that are basic health beliefs that we all need to know, but many of us don't know. And that is why it takes a team of people to help women through all their different stages. And women over 40 have been left for garbage along the road. But I am not standing for that. And there are many healthcare practitioners also not standing for that. So hit the plus sign, follow along, share my stuff if you like it, share it with your aunties, share it with your best friend, share it with your daughter. Let's begin a culture of talking about the dysfunctions and sharing the good information.